Welcome back.
Thank you. Hi everybody, we're just going to do some quick introductions. So my name's Jo McIntosh and I'm the Chief Experience Officer with Northumbria Healthcare.
I'm Stephen Chater, I'm the Staff Health and Wellbeing Lead in the Public Health Team at Northumbria.
And I'm Patrick Price and I'm the Trust Equality, Diversity and Inclusion Lead.
So thank you very much for this opportunity to talk about our Staff Engagement Improving Staff Experience programme. We thought it might be really good to start by giving you an overview of Northumbria Healthcare and the patch that we cover. So we are the biggest geographic trust in the country, so we've got a massive geographic area that covers a whole broad range of communities. And many of our staff, a high proportion of our staff, are members of our community, are also our patients. So we range from some of the most affluent areas in the country, so places such as Alnwick, that you will know the famous Harry Potter castle is based, right through to we've got urban areas, so North Shields, and then a lot of ex-mining communities. So we actually have some of the most socially deprived communities within our patch, and that's where our staff live as well as work. So lots of challenges in respect of supporting our staff to have good health and well-being. So I think many of you will know that Northumbria has a nationally recognised patient experience programme, and I would like to think that we're actually there with our staff experience programme now. So it's very much embedded in what we do. So we take part in the national programme and we also do the pulse surveys, but we have our local surveys. So every quarter we are speaking to our staff at a trust level. And that's because we absolutely acknowledge the link between staff experience and patient experience. And the words that we use within Northumbria are inextricably linked. So just last night, I was at a governor's meeting where our executive director for HR and OD, our NED, who leads on all of the workforce related, our staff side, were actually talking about this topic to our public governors and giving them reassurance and reinforcing why staff experience and staff health and wellbeing is so important within our organisation. So how do we do that? As I've already mentioned, we have a broad programme, so we measure quarterly, whether it be through the national survey, through our local surveys. And that's that broad aim to understand what really matters to staff, what gives them a good experience, how can we support them to have good health and well-being. But we also have a deep measurement, and we have a programme called Working with Teams, and within that team we have ex-clinical professionals, we have a clinical psychologist, and it's a whole range of programmes that run from being a psychologically based relational workshops, pause and reflex, right through to staff experience improvement workshops where staff work together, and we as a team work collaboratively across the organisation with OD, with HR, with our freedom to speak, and we triangulate all of the data that we get to be able to understand the experiences of our staff. And this is just a view of the programme report that comes. So it's embedded into what we do. Our teams, so we report at trust level, so we're able to track our performance over time. We report at business unit level, and then we report at individual level where we've got 10 or more respondents within a team. And our business units, our teams, they know that these reports come. We look at them, they're talked about at trust level, in board, in our executive management team. They're talked about in business unit boards, and they're talked about at team level. And this is some of the communications we do around the organisation in terms of our infographics. And I think what's really important for us is that we present patient and staff experience data together so that we show, and Paul, who's in the audience, is responsible for this amazing work. We're showing that the two go together, we never ever separate them. I'll hand over to Stephen.
So as I mentioned when I introduced myself, I sit in the public health team at Northumbria NHS, and we're really fortunate to have a really big and expanding team. So as it says there, we only started in 2018 with one consultant, and we're now up to over 30 members of staff. A list of the different disciplines within public health is massive. So we have our health coaches who work into different patient pathways. We have our best start in life advisors they're a multi-award winning team there who work with mums or expectant mums. We have our tobacco dependency team, we have our data analysts who help us so much to ensure that what we're doing is reflective of what staff want and not just us guessing. We're operational service managers, and obviously as relates to now, staff health and wellbeing team. And I think it's important to say as well that staff health and wellbeing isn't just driven by us, it's driven by a multidisciplinary team across different parts of the Trust, including staff and patient experience, comms, HR, OC health, and of course ourselves as well. And why? Well, I think you're probably preaching to the converted here. We can have some massive impacts on reducing health inequalities, improve the health of our communities, and have hopefully better outcomes for staff, which we know leads to patient outcomes. So, in 2022, we did our staff health needs assessment, linking in with staff and patient experience to run that survey. And Joe's just going to talk through some of the results and outcomes that then shaped what we took forward.
So I think, the stuff that Stephen's talking about in terms of the health and wellbeing really illustrates and underpins the collaborative approach that we take within Northumbria, working across departments, working across business units to be able to support our staff in terms of their health and wellbeing. So this is some of the work that we do with and for the public health team every year. So it's the health and wellbeing assessment, and what we do is that is included in our April local survey, and it's a number of questions where we look to measure and understand the health and wellbeing needs of our staff. And what this is on the left-hand side is the domain areas that we split it into, so it's nice and easy for people to understand. But then we'll also then look at question level. And what we found when we did it in April 2022 is the fact that many of our staff were suffering with the financial crisis that we're having as a society at the moment, and how that was impacting on the health and wellbeing of our staff. And we saw a sustainable change, particularly in those questions. And then what we were able to do, working with the public health team and with our own team, is to then break that down to understand, when that diagram before where I showed you the deep and the wide, so this is where we start to get into the deep, and we really start to look at what do we understand within those questions around at band level. Is there a particular group of staff that are suffering more than others? And what you can quite clearly see there is it was band 2 and band 3 in particular.
So, as we've just talked about, obviously the survey has given us lots and lots of information to work with, so we know that our staff want support with mental well-being, with healthy weight, but also financial well-being is something that's come out, which obviously can't have escaped everybody over the last couple of years. So we were really fortunate to have a couple of members of our public health team able to do some work specifically with NHFM, who are one of our subsidiaries at the Trust, working specifically with staff who we recognise would probably require a little bit more support around the financial well-being, but we needed to know what that support was. For example, we talked a bit before about digital exclusion, so thinking about how do people access the information that we provide, or do they not access it at all, quite possibly. So that was the kind of aims of that focus group, to take us to where we wanted to go to next. And these were just some of the key themes that were identified. I'll not read them all out because you can all obviously see them. But as I mentioned, digital exclusion was a big one. Communication in terms of sometimes not being aware of what the staff offer is. Work-related factors will impact upon financial well-being. But positively, some really good examples of positive manager and team support. And I think just on that note, we have a really strong network of health and wellbeing champions who volunteer from the workplace to support their colleagues, and they've been really important in us getting these messages out. So just a snapshot of some of the things that we did, some related to financial wellbeing specifically, and some a little bit more broadly related to it. So we have a really strong partnership with the Northumberland Community Bank, which is both a savings angle, but also a loans angle, so to try and steer people away from potentially accessing loan sharks or payday lenders, high street lenders. The bank provides ethical loans. We've also had free fruit and veg, we've had free meals, we've had discounted travel passes and a gym membership, which is £10 joining fee and then £1 per month, so heavily subsidised. And these are just some of the key stats. Just to mention that we actually produced a physical leaflet off the back of the focus groups around financial wellbeing, because we recognise that people don't always access things electronically.
Okay, last but not least, and very quickly, one of the things you recognise when we're doing these kind of things is pointless just doing them on a one-off basis, just because it's based on something that's happening nationally. This has been consistently something we've done over the years. So one of our surveys in April, we always have an opportunity to add any health and wellbeing questions there. So we've done stuff about financial well-being, but we've also done stuff about disability and kind of the kinds of areas that people need to see. So I know we've got to finish now. So all I wanted to say is if you're going to do this, do it with your staff rather than without them. So we engaged with our staff before we formed the questions. Then we kind of implemented it. We had a very high level of response. We had over a third of our staff, over 4,000 staff, routinely respond to our internal surveys, and we got the highest response rate in the national staff survey. And that's because we work very closely with them. And I think somebody put on the last presentation, you know, that you said, and we did, we do that just on a routine basis, and that's supported right from the very top of the organisation down to the bottom. So, really, I know we ran out of time, so I will stop now. I'll be very good. Just one last thing. We've got 10 staff networks, including staff with disabilities, BME staff, LGBT staff, etc. And we really engage with them very closely because they're the staff that generally have the worst experience in the trust. And if we get it right for them, I think we get it right for everybody else. So it's really critical that you take that nuanced approach. I'm shutting up now.